Hi, Dr. Dennis Lensling, Clinic Administrator for Advocare Clinics. I'd like to talk to you today about carpal tunnel or carpal tunnel syndrome. What we'll usually see is somebody will come in, they'll complain of pain in the wrist, you can tap on it, it can feel tingly, you can have shooting pain through all your fingers. Usually what you're doing is a lot of keyboarding, or you're doing a lot of repetitive movement with your arm and hand on some sort of assembly line, hammering, a lot of grasping, a lot of things like this. What you're doing is you're building up tension through the forearm. So there's a muscular component to it. But at the end of the day, what they found is that carpal tunnel is really an entrapment, not a pinch, it's a choke. And the choke starts upstream. You always got to think of water flowing downstream. And where the first pinch in the garden hose is right here. The muscles in the neck or at the spine itself in the vertebrae getting trapped. So if my finger's a nerve, it's not pinching it, but there's muscle or tissue that are strangling it. It's too tight, like a vine wrapping around a tree. So it tethers it, so it makes it really, it can't slide. So that nerve gets tethered and hung up, and there's supposed to be slack. There's supposed to be elasticity to a nerve, and that's taken out of it. So the nerve starts to get traumatized from that damage. It's easier irritated. Normal daily movement, just turning your head, raising your arm up, or the continued use of your hands on a keyboard will overstress that. You get a crush here, you get a crush at the shoulder, the next crush happens down in the elbow and forearm. So if you put 2 or 3 crimps in your garden hose, there's no water coming out, okay? Same phenomenon. That's really the start of carpal tunnel. Going in and having carpal tunnel surgery here, once you're to the point where that ligament is that damaged, you've had this process going on for years. But if you never deal with this, you are going to get this back again. So in our office, we combine medical. Our doctor is a surgeon who actually does microsurgical carpal tunnel release for the bad situation. We also combine chiropractic, acupuncture, physical therapy, deep tissue massage, and even laser therapies at times to release all these nerve entrapment and adhesions here or down your arm. Same thing holds true for the lower extremity. Down there it's called sciatica, but it's a similar process. So sciatica or carpal tunnel, same process to the body, different names on location. If you're dealing with any of these, please give us a call.